talk to me about sourcing a little bit. What does it actually mean at that stage before you're even manufacturing?
When we're developing something today, it's not like what is going to sell, it's really like what is that science going to support overall. There's purity and safety testing, looking at contaminants, microbiology quality. Beyond that is bioavailability. We don't care if an ingredient looks promising on paper. We're going to invest in our own pharmacokinetics.
Welcome to Inside the Formula, a SuppCo original series where we go behind the science of supplements that have earned the Tested by SuppCo certification. Each episode, I sit down with the formulators, chemists, and scientists behind these products to find out what it actually takes to make a supplement that works.
I'm Jordan Glynn, head of science at SuppCo. My guest today is Dr. Malisa Carullo. Malisa holds a doctorate in naturopathic medicine from the National University of Health Sciences and a master's in biology from the University of Ottawa. Her clinical focus spans chronic disease, healthy aging, endocrinology, and the integration of naturopathic and sports medicine. As Senior Manager of Medical Information and Safety at Metagenics, she leads clinical services support, ensuring healthcare providers have access to evidence-based product information while advancing practitioner education and integrative health solutions. Before we begin, an important reminder. Tested by SuppCo is an independent certification program that SuppCo offers as part of its business model. Brands featured in this series have paid fees to have their products analyzed by the tested program, which tests that the products consumers actually buy to verify their active ingredient claims. Test results are published transparently, pass or fail, and cannot be influenced. Today's episode features a brand partner. And now, my conversation with Dr. Malisa Carullo. Welcome. Malisa, welcome. We're excited to have you. Thank you for joining.
Yeah, thanks so much for having me. I'm excited to be here.
Yeah, so you've been at Metagenics a long time. This is what are you guys working on these days? I'm just curious to know what you guys have going on.
Well, yeah, I've been here about 12, 13 years, actually in July. Some of the things we're working on are kind of top secret, so I can't tell you, but I think that a lot of the things we're working on are still metagenics in nature as far as deep science, some emerging ingredients that we're kind of leading up on. And yeah, hopefully we can talk about some of those today in our conversation.
Yeah, I'm very much looking forward to this because Metagenics has been around for over 40 years at this point. And so when you think about the history of Metagenics, what does that length of time, that tenure really mean in practice? And how does it affect the way that you all are building supplements today?
Yeah, I think that's a great question. It's a really great kickoff question, actually, because I don't think most people realize that Metagenics kind of started as more of a research organization and then stumbled into products, right? So I think that order of operations just kind of shapes things overall. We've evolved into this global leader. We're, a science-based nutraceutical company with solutions, but the DNA of our company, that backbone hasn't changed. So I think when we're developing something today or, we have a question in mind, it's not what is going to sell. It's really what is that science going to support overall? And so, yeah, I think that even before formulating begins, we put a lot of time into understanding consumer and patient needs. And we go deep into the ingredients, mechanisms of action, that systems biology and the clinical outcome that we're hoping for or striving for.
And that's so when I think about supplement development, that's interesting the way you put that, because there's kind of a chicken egg piece, right? Do you start with an ingredient that's hot, that's on the market, that's exciting, or is there a goal that we're trying to address that then we want to go find the right ingredient for? How do you guys play that push-pull game?
Yeah, probably all of the above. Again, it can start from either an ingredient or an indication, but I think most often it's going to begin with an unmet need. And that need is usually going to be flagged by our practitioners, our, key opinion leaders. They're the ones that are coming to us. They're telling us where their patients are struggling, what conditions aren't being serviced well, and maybe if there's gaps in the existing solutions that they're using or it's not covering those solutions. So from there, we might, translate that need into a concept, dive into again, that systems biology, that underlying biology, what pathways are involved, what kind of intervention could realistically make a difference for those gaps. And then we could look at what ingredients might be best suited based on really solid clinical evidence. Yeah, I think it's possible that an emerging science or this novel ingredient can absolutely spark, some interest, a new idea. It definitely happens. But even then, I think we're trying to anchor it back to that same question. Is this going to improve outcomes for a patient or a consumer? If we can't answer that, I don't think we're going to move forward with it.
And I like that a lot because one of the things that I think makes Metagenics special is this concept that you're getting a lot of input on the front end from actual practitioners, people that
Yeah.
are working with patients directly. But I know that you're also going to be getting input from the marketing side, the brand side thing. Oh, we're seeing this. How do you
Totally.
all bring together all these different inputs when you're ultimately deciding the types of products you want to move forward with?
Yeah, and you kind of like hit it on the head there. Like we're going to hit all of these different places. I think they're weighted differently. So I think that the loudest signal by far is going to be our practicing healthcare practitioners, our KOLs that we interact with.
And so one of the things that I think is really interesting and kind of special about Metagenics is that you're getting so many inputs from doctors, physicians, from people who are actually working directly with patients, but you're also probably getting input from the brand side, the marketing side, maybe even leadership at the company. And how are you all reconciling those different inputs when you're ultimately deciding what product you want to work on next?
Yeah, absolutely. I think all of those areas will have, somewhat of a say, but I think that all of these things are weighted differently. Again, the loudest signal by far is going to be our practicing healthcare practitioners. So, MDs, specialists, naturopathic docs, dietitians. We have a full spectrum. And that's important because they're the ones seeing patients every day and they can give us some great feedback as to what they need and what they're looking for. At the same time, we're continuously monitoring like peer reviewed literature, new studies that are being published. We attend scientific conferences, we visit trade shows. And that's really important because that's where we get to chit chat with suppliers, right? About emerging ingredients. And it's also how we just stay at that forefront and anticipate where we might want to go with our like next product development. Yeah, I think the last layer, which is like a little bit underrated, is the patient reported outcomes. You kind of like
Mm.
mentioned this, but this is coming back through clinicians as well. So that tells us how patients are you know, doing with the products in real world time, right? Like how does that product perform beyond that controlled like clinical trial environment? And that's like really important information when we look at patients and clinical viability. So I think putting all of these together, as you mentioned, like reconciling these inputs together is super important. So we're looking for conversions. So if we can see the clinical experience, the literature, and the patient feedback kind of like all line up in the same direction, like it's a field day, right? We know we're headed in the right direction and we have something really real that we should be following.
And you talk about patient outcomes, which I think is a perfect note because you guys actually have an entire team internally that is dedicated to whether or not ingredients actually work in the body, not just theoretically, not just on paper. And so, as you're thinking about that next step, what does that evaluation look like? What would ultimately maybe even disqualify something from entering in the formulation process?
Yeah, so now you're hitting questions where the responses are near and dear to my heart, like this quality stuff, right? So, well, this stuff, every ingredient goes through like a really rigorous raw material evaluation, and that's before it even gets near development. So, we start with identification, specification, like is the material actually what it's supposed to be? Does it meet the standard? Is the supplier documentation complete when we receive it? There's purity and safety testing. So, looking at contaminants, microbiology quality, there's physical and chemical attributes as well, batch to batch consistency. All of these things are taken into account. And then beyond that is bioavailability. And that's one of our key pillars at Metagenics, mostly because we don't care if an ingredient looks promising on paper. We care whether it can actually be absorbed and act in the body. So we're going to invest in our own pharmacokinetics and bioavailability testing rather than just like rely purely on what the supplier tells us and the claims that they're giving us. So that really gives us at Metagenics like a much stronger science basis for our own decisions and a really good basis for data and loyalty with our partners, right? Practitioners, patients, consumers. Yeah, and then I think there's also dose, right? So an ingredient can be biologically active in theory, but if the effective dose is like unrealistic to formulate, it doesn't translate into the product very well, right? That product is something that no one could use. So we need to ask some tough questions like, does it work? Does it work at that dose that's practical? Is it stable, commercially viable? These are all like really important questions and part of like this entire whole evaluation chain that needs to be completed. And it's just part of our normal, like everyday activities when we're looking at this at Metagenics.
And a couple of words there you say raw materials, you say vendor, and the first word that comes to my mind when I hear that is a word called sourcing. Now, you and I probably think about sourcing a lot. We talk about it a lot, but for people that are buying supplements on a day-to-day basis, sourcing is probably something that never comes up. So talk to me about sourcing a little bit. How do you approach it? What does it actually mean at that stage before you're even manufacturing a product?
Yeah. So quality at this stage is, first of all, like the supplier check and a raw material evaluation. So knowing exactly where that ingredient comes from, who produces it, what are their safety standards and processing standards, and how is it handled and tested. And that's all done before it even crosses the manufacturing facility door at Metagenics. So it means this like very rigorous, again, supplier qualification with audits. We review their good manufacturing practices. We assess hygiene, traceability, all of their documentation. Metagenics definitely insists on like robust incoming material testing against our own specs as well, though. So we're not just going to rely on what is being passed over to us from the supplier and their certificate of analysis. And that's because, you know, variability in the raw materials can directly undermine efficacy, safety, and shelf life later in our process when we go to market. So all of those are very important. And then finally, we integrate sourcing with cross-functional teams at Metagenics. So our research and development folks, they'll be brought in, regulatory, clinical team where I'm part of. And all of this is important at the beginning because when we try to like layer that in further down the road, it's just too hard to like retrofit it later. So most of that happens like from the get-go at the front.
One of the things you guys do, so you do all that testing on the front end while the product's being made, but also you were willing to publish your own research on your own formulas on the back end. And you're actually publishing scientific research to show what the work that you all are doing. And so what does that signal about the accountability of Metagenics and maybe more importantly, what happens when that data doesn't say quite what you hoped it would?
Yeah, those are tough questions internally when that happens. First and foremost, like publishing our own formulas, data signals that like we're going to take accountability seriously because we're putting our products through this like rigorous hypothesis and scientific scrutiny, right? We're not asking consumers or practitioners to just rely on the product alone or like this trust factor. We want to show them evidence. We want to generate the evidence. It's peer reviewed. We want to test that actual formula. We want to test it in humans. And like I see this as a sign of, confidence, but it's also like very disciplined and responsible. So I think it means at Metagenics, we have to be comfortable with transparency, especially when the data just doesn't fully support what we hoped it did, right? And that's going to happen. That's science. It's, that unexpected or negative result isn't, failure. It's just information that's going to help shape that product either in the near future or like going forward. So, my expectation always is that we just report what we find objectively, we learn from it, again, use it to refine the formula, the dose, whatever it might be. And it could even be like the underlying hypothesis. I think the alternative is just like only publishing what flatters the company or what consumers want to hear. And like that's really just not science, right? That's more fluff.
So along those lines, you're talking about all the testing, all the things that go on, but when the data don't go quite how you hoped it would, when have you really had to stop a product in development or even really significantly reformulate one because it really didn't meet the standards that you were looking for?
Yeah, completely. It does happen. I think the decision almost never comes from like one bad data point alone. It comes from more of like a pattern of what might be emerging in our testing. So it could be like active ingredient drift over time, or our batches come back inconsistent over time or over multiple batches, or maybe the formula is just like simply not delivering the dose needed to reasonably have like a clinical effect or benefit in the patient or the population that we're seeking out. So when we see that pattern, it goes again to like this cross-functional team. We have R&D, quality, regulatory, our clinical team, and we work through options together. There could be many options on the table, like change the strain, add an overage, maybe swap an excipient, change the packaging, and like last resort is like just pull the product altogether. So I think these conversations are definitely uncomfortable, right? Because there's already some money being invested, but they're absolutely necessary. And that's because it just protects the practitioner, but ultimately the patient population that like we're seeking to help in the future, right? On the other end. So it's just really protection for everyone.
I mean, you guys do so much testing internally, and one of the things that comes up a lot externally is this concept of third-party testing. It's really become a
Mhm.
buzzword. You hear it everywhere you go, and the rigor behind it is really wildly varied. So, what was Metagenics' decision to ultimately come through and pursue the tested by SuppCo certification? What does that mean to you guys in the brand?
I think buzzword is an understatement when we think of third party testing, but independent verification means that we are letting an objective, external, accredited lab, ISO accredited, it could be Eurofins or Bioform, those are examples that use validated methods, test our products themselves. And Metagenics product label, the dosages that are listed, the claims, they reflect the testing results. So when we align our brand with SuppCo tested, we are signaling that like our definition of quality is not just this internal definition, it's external, validated, transparent, and repeatable over time, over and over again. I think again, like it just also gives us this disciplined feedback loop. So if a product doesn't meet any of these standards, we treat this more as like a mandate to improve our formula or like the sourcing of the raw ingredient or the process of controlling throughout the manufacturing process rather than just like this excuse to avoid the test altogether. So yeah, I think it's a fabulous partnership because we are aligned in that respect.
Now, and I love that you talk about this concept of wanting that external validation. There's a lot of like just trust me that happens in the supplement space, and this concept
Totally.
of being willing to go external, I think is really valuable. So we've talked about raw ingredients, we've talked about sourcing, we've talked about testing throughout the process, the final product. But then you guys have a team that will even follow a single product up to 2 years on a shelf just to track
Yeah.
stability. Tell me about that process and how that holds up over time.
Yeah, I think that fun fact alone that we will track products or ingredients for, 2 years or more, I think is mind-blowing. But to expand on it a little bit, we follow products through 2-year stability programs, and the biggest lesson is that we could have strong ingredients, but they aren't enough on their own. That matrix that they live in is really, really important. So how actives interact with each other, with the excipients, moisture that might be present, oxygen inside the dosage form that could drive stability more than the raw material spec alone. We've seen like certain actives that look great analytically at release, but over time, they're just going to perform poorly because of maybe pH shifts, and they could be subtle shifts, oxidation, moisture uptake again in the finished product. And so when products struggle, they rarely fail suddenly. It's this like very slow, predictable degradation that traces back to like a formulation choice or maybe like an environmental exposure. So heat, humidity, light. It's why, most times we will see our formulas packaged in a darker brown bottle to account for some of the light that might hit or change that product. So the products that hold up over time, they tend to share three things in particular. It's the active is inherently stable. The formulation that we have packaged it in protects it. And then that packaging is going to match how sensitive the active really is. So it's such a process and it's a very, very thought out one. Yeah.
It's interesting because when you buy a supplement, a lot of times you just see a packaging on a shelf. You don't necessarily even think about, oh, this was made in a specific way or put together in a specific way that's protecting the product. Like that, I think for most people is kind of just lost altogether. And
Yes.
then there's a concept of when you're buying a product, there's what the science says it does, and then there is all these claims that people might think it has or that they've seen on TikTok or social media. How do you guys draw the line on the claims that you're willing to make internally?
I think just it starts and ends with the science. We only make structure function claims directly supported by the evidence. And where we can, we want that to be evidence that is metagenics evidence. So we design our own clinical trials, we run human studies on our own brand and key formulations. So our claims are going to be anchored in data like we've generated. It's not necessarily coming from pre-existing literature that might be outdated or underdosed, or on the single ingredient. We're really trying to look at data of the entire formula. But at the same time, we run consumer perception trials. So again, this is like real world use studies, surveys, experience tracking from patients, right? Like, how did they feel on the product? How did it perform in everyday life? Was it like chalky? Did it mix well? Did it, just pull at the bottom of your shake container? All of that data helps us shape that consumer facing language. It's still grounded in science, but it's just going to reflect like how people experience the product. So bottom line is like we won't make a claim if we can't back it by our own clinical data. And we want that to be like evidence that we could reproduce in the literature over and over again.
I think that makes sense. And when you talk
Mhm.
about that, if a product is not enjoyable to take, or at least if it's painful to take, nobody's going to do it, right? And so I think you have, no matter how good it is, you have to do exactly what you're saying on the back end as well to make sure that it's being used and absorbed appropriately. And
Right.
so there are so many things happening in the supplement industry right now. What's one ingredient or even mechanism that you think is genuinely, like, personally underappreciated or even misunderstood in the industry right now?
Yeah. So for me, it's hands down specialized pro resolving mediators, SPMs. Do you know about them at all?
I've heard about them, but I think we should elaborate them on significantly here.
Totally. Yeah, yeah. So they're one of, I believe, the most underappreciated mechanisms in immunity and inflammation right now. So they are typically called SPMs, but they're specialized pro-resolving mediators. These could be things like resolvins, protectants, and they are endogenous, so internally made lipid mediators. They don't just blunt inflammation, but their job is to actively just orchestrate its resolution. So, in like layman's terms, that means that it helps clear immune cells from tissue, support repair mechanisms. They signal the immune system, to move towards this like more balanced, healed state. And I think, like, just frankly, most of the industry still thinks about inflammation as something that we should like block or modulate. I think it's just something clinically that's easy to do as well, right? But the SPM science shows us that if we don't resolve inflammation, is actually going to drive chronic pathology. And that's where I think this framework starts to shift. So really important. I think the other thing that gets missed is that um, a lot of people take omega-3 fatty acids, right? Like EPA, DHA, but they assume that taking more omegas will just, mean you're going to produce more SPMs. But we have human data and it just does not show us that. It does not support that hypothesis. So the conversion from EPA DHA to the functional SPMs is quite inefficient, especially when you kind of pair that with like metabolic stress, lifestyle stress. As we age, there's like age related changes. This is all exactly why formulations like SPM active can be far more meaningful than just like taking fatty acids like EPA, DHA. But the market is still talking about like high dose fish oil, just take more EPA, DHA instead of like resolution support. So I think this is going to be a big deal, especially like in the coming years, not just for inflammation, but like clinically how we approach treating those with like chronic disease. It's going to be really key.
Interesting. I mean, what a great educational, like, nugget to have there. And so
Yeah.
from there to from your side to the metagenic side now, what do you want people taking metagenic products every day to actually understand about what went into making them? What's the thing that people should know that's never going to make it onto a label?
Yeah, great question. I think that means I must be rambling a lot, so I need to sum it up, right? I think I want people to understand that behind every bottle or bag of protein, we have like this long, deliberate process that includes science, quality control, trade-off decisions that just never fit on the label, right? Consumers, I think you even mentioned it, like they see the ingredient list and the benefit claim, but like what they don't see is all the extra hours spent choosing the right form or like the right dose. What's the right matrix to deliver it and keep it stable? They also don't see just like the work that goes into all the quality testing, the packaging, the batch to batch consistency. And I think that like really shapes and determines whether like what's printed on the label is still in its deliverable form and active form 18 months later. None of that fits on the label, but all of it is what makes the difference between like quality supplement products.
I love it. And last
Mhm.
question for you, personal one, Melissa.
Okay.
What is one supplement that you personally cannot live without? And what's the one
Yeah.
supplement you think is flying under the radar that you wish more people knew about?
Okay, that's tough because there's a lot of supplements I love. Let's do the one flying under the radar first. So SPMs again, I just love
Okay.
this one. Same reason as before. I think that like again, instead of blocking inflammation, we just need to help the body move towards healing and resolution. And it's just like a very sophisticated product. It's under the radar. I love that one. Um, One I could not live without, probably magnesium, and it's just because, like, it underpins so much, right? Like muscle health, relaxation, sleep quality, energy metabolism, nervous system, everything, right? Like homeostasis. And I think in modern life, there's so many variables that we're exposed to, high stress, certain pharmaceuticals that deplete it, and most people are chronically suboptimal in magnesium without realizing it. So probably magnesium.
Do you have a specific subtype of magnesium you gravitate toward?
Well, again, I think it just depends clinically what I'm treating.
Okay.
Magnesium glycinate is going to be my favorite. Obviously, it's my go-to, but there's instances where it just clinically makes sense for me to give like a magnesium citrate, depending on what I might be treating or how acute I want the response to be. Yeah.
Love it. Around for over 40 years, Metagenics, incredible amount of testing, quality across the board. Melissa, thank you so much for joining me today.
Thanks.
It has been a pleasure.
Yeah, well, thank you. And just thanks to SuppCo and to you, Jordan, because I think conversations like this are exactly where Metagenics' story just gets to come through, and I just appreciate the space to tell it. So thanks for having me.
We love it. Have a great day. Thank you.
Thanks.